Good morning, good morning, good morning. Time check it is 12 minutes after 10 this beautiful Monday morning. Today, the 27th day of April 2026. And you're tuned to Women Radio 91.7 FM, the voice of women. Nigeria's first and only radio station for women and their families. This is Radio Doctor, Nigeria's first specialized health program where medical doctors consult and advise on radio on your Women Radio 91.7. Radio Doctor is broadcast 10 a.m. to 10 a.m. Mondays through Fridays, and each doctor that comes in is basically giving us specialized health. Today is for children, and of course, if you know that today is for children, you know that we have Dr. Olufunlola Akiola, a consultant pediatrician at St. Ives Family Hospital. The phone lines will be open shortly, but when they're open, you can send in your questions, you can send in your concerns, whatever it is, just send it in. The number to text is 0703 and we are live on YouTube at WFM 917, and you can listen to us on the go via our website www.wfm917.com. Let's welcome our doctor this morning. Hello, Dr. Fumila Olufunlola Akinola. How are you this morning? Good morning.
Good morning, for me. Nice joining you once again.
Yes,
After
yes.
a long sort
After
of
a
break.
long time, yes. Sing happy birthday.
Thank you very much.
Yes, yes, yes. Okay, let's just get right into it this morning. We are going to be talking about childhood fever in children. So, the first question to ask Dr. Amakenla is, what exactly is a fever?
Um, a fever is a body reaction to infection. It's a way the body reacts to invasion by infective organism. And it is generally defined as a body temperature of 100.4 degree Fahrenheit or 38 degree centigrade or higher. While this is the standard, the reading can vary slightly depending on where it is taken, either rectal, ear, or
Mhm.
forehead temperature.
Hmm.
So, in summary, fever is a way the body reacts to invasion by organism, and it is usually defined as a temperature of 100.4 degree Fahrenheit or 38 degree centigrade or Celsius or higher.
Okay. So, Dr. Kane has answered that question, but so you're saying that when it is higher than that, that is when the child has a fever.
From 38 Celsius
Mm-hmm.
or 100.4 Fahrenheit or
Mm-hmm.
higher.
Mm-hmm.
Yes, that is when you say that it's fever. We
Mm-hmm.
can have low grade fever, which started from 99 Fahrenheit or 30, or 37.5 centigrade. Those ones are mild fever. They are low grade.
Right. Okay. Now, why do children develop fever more than adults?
Um, Children develop fever more than adults, more often and at higher level than adults because their developing immune system overreacts to new germs, producing more pyrogens, which are fever-inducing substances. Their body also have higher surface area to volume ratio, causing faster temperature fluctuation, combined with higher metabolism and less efficient sweating to cool down. Um, the children develop in a child because their system is just developing. the immune system is their inexperience. So they causing them to mount a more intense, vigorous inflammatory response, leading to higher fevers compared to the more measured response of an adult. And children, they are constantly exposed to germs,
Mm.
especially children, particularly those that go to crèche, daycare school. They are frequently exposed to new viruses and bacteria, prompting regular immune uh, response. And also, um, small children and infants have a larger surface area relative to their weight, leading to faster heat loss and fluctuation. They also have a faster metabolism, which creates more warmth.
Mm-hmm.
And in young children, they often sweat their they sweat less efficiently than adults, making it harder for them to reduce their body temperature, resulting in higher reading. And also, beyond illness, teething, dehydration, excessive physical activity, or hot clothing alone can trigger increased body temperature, as explained when we continue in our discussion.
Okay. Now, is fever a normal thing? And I say normal really carefully. Or is it an indicator that something is wrong in the body? Yeah, that's the question.
Um, Fever is not itself is not a disease.
Mm-hmm.
However, it is a symptoms or sign of an illness. It is not a disease itself. It acts as a temporary increase in body temperature, often triggered by the immune system fighting, it's triggered by the immune system when it is fighting infection, such as the viral or bacterial infection. It can also caused by inflammation in the body or other underlying causes. It serves as a defense mechanism to help the body fight illness. So it is not a disease itself, but it may be a sign or symptom that something is wrong in the body.
In the body. Okay. So when should, oh, before that question, what are the most common causes of fever? You mentioned, when the child's immune system is down, but what are the most common causes of fever in children from our environment or in our environment?
Um, Based on the um, general epidemiological data for tropical and subtropical environments such as ours,
Mm-hmm.
um, infection is the most common cause of fever in our environment. And when we talk about infection, specifically in this region, we have several infections, that uh, and disease causing organism
Mm-hmm.
that our children, you know, have to fight with or
Mm-hmm.
are exposed to before they get to their adulthood. One of it is malaria. In this part of the world, uh, it is widely recognized as a leading cause of acute or febrile illness in the tropical environment in which our environment is endemic to. Um, others include viral infection such as respiratory infections, common cold, influenza, COVID-19. They
Mm.
are among the most frequent causes of fever in children in our environment. Viruses is one of the cause. Then we have dengue fever. It's also a major cause of fever. Typhoid fever. Uh, we have environmental causes too, such as hot climate, heat-related illnesses. And so there are different uh, disease or causing organism, and also fever. I mean, this, fever causing, I mean, disease that our children are exposed to that cause make them to cause to have fever. But majorly, they are caused by viral infection, which cause cold, flus, viruses, gastroenteritis, bacterial infection. They cause pneumonia, sinus infection, strep, ear infection, throat infection. Vaccination can also cause a mild fever, and even uh, I mean, those are the major causes of fever in children in our environment.
Okay, thank you so much. So when should parents start considering, you know, the hospital, or when should they consider a fever is not normal, or that it's how do I explain this? When should parents say, oh, this fever is not the one that dangerous, or is all kinds of fever, is fever dangerous whereby just go to the hospital? I'm asking this because there's sometimes that your child's temperature is high, and then you do like a cold compress, maybe you give them first aid at home, you give them painkiller at home. Which How does a parent differentiate between the one that, oh, we don't need to go to the hospital, we can stay home to treat, or we should go to the hospital? Or are you saying the moment your child is having temperature, take that child to the hospital?
I will answer this question by saying that fever is, as we define fever, as temperature of 100.4 Fahrenheit or 38 degrees Celsius or higher, uh, is considered, uh, and it is considered a normal immune response to infection rather than an illness itself.
Mhm.
So, parents can generally view fever as normal or manageable at home. If the child behavior is normal, it may mean that the child is still playing, drinking, and interacting with others. Even if they are still having this high fever, you know, parent can still do home management, expose, remove overclothing, uh, give paracetamol, use of cold compress, for for the child. But however, for for a fever that is up to 38 degrees Celsius or higher, in a child that is under 3 months old, then we have to take this kind of fever as emergency. When you have fever that is higher than 40 degrees Celsius, you know, and does not respond to medication, and is lasting more than 24 hours, please, this kind of fever is an emergency. Take this child to the hospital. And a fever that is lasting more than 5 days, despite intervention, use of antipyretics, you know, and despite use of cold compress,
Mm-hmm.
and this child is still running fever for more than 5 days.
Mm-hmm.
Please let this child go and see a seek medical uh, attention. And when you have a child, I mean, a fever, no matter what what do I call it now? The measurement, either less than 38 Celsius, which is our mark, and it is associated with unresponsiveness, inconsolable crying, or or the fever is associated with difficulty with breathing. Please take this child to the hospital, to seek medical attention. Or at any level, fever at any level in which there is sign of dehydration, child is dehydrated, the mucosa is dry, is not able to drink, is not able to drink, and diaper is dry, no tears, or child is not making urine. Please, and also associated with anterior sunken of anterior fontanelle. Please take this child to uh, to seek medical uh, attention. So, while high temperature can be alarming, they rarely cause brain damage unless it is exceeding more than 42.2 degrees Celsius,
Mm-hmm.
which is very rare. It's very rare to see that sort of high fever. But however, what parents should focus on is the child behavior, not just the thermometer reading. So even the thermometer is showing low reading and you are seeing abnormal behavior, child exhibiting abnormal behavior, you know, uh, not breathing well, not responsive to call, I mean, not responsible to the environment, child is in coma, please take this child to see a medical attention.
Okay. Thank you so much, Dr. Kimla. You're still tuned to Women Radio 91.7 FM, the voice of women, Nigeria's first and only radio station for women and their families. And this is Radio Doctor this morning with Dr. Olufumilola Akinola, a consultant pediatrician at St. Ives Family Hospital. And Radio Doctor is Nigeria's first specialized health program where medical doctors consult and advise on radio. So we've been having a discussion with Dr. Kenna on childhood fevers. When do you start making moves as far, what should I do? What should I do? What should I do? Okay. My next question is this morning. Can teething cause fever in children, or is it a myth? Because I remember that when my children were teething, they start becoming cranky, maybe they're running temperature. You now say, oh, it's because they are teething. Is it a myth, or is it the teething that's causing the fever?
Uh, I would say that teething itself, it does not cause a true fever.
Okay.
We have our what do I call it now? Landmark for fever. You mentioned that temperature that is higher, you
Mm-hmm.
know, fever can be classified as low grade, high grade. But the one we have to be so much, that we need to take action is when it's higher than 38 degrees Celsius, 38 degree or higher. It can, and when we now talk about teething fever, most of the time, yes, teething can be uncomfortable, uh, and can cause mild fever.
Okay.
However, true, um, though teething can be very
Anyway, decision for women a bit.
uncomfortable, but your child does not necessarily have to pass through all this
Mm-hmm.
before it can erupt his or her tooth.
Mm-hmm.
You may just wake up one day and you notice this child smiling at you with two lower teeth without any trouble. What happened is that during the period that these children are cutting their teeth around the age of 6 months, it's also the time that they are also prone to infection.
Mm.
You know, around this period, they are more or less aware of their environment, picking something on the floor, putting it into their mouth, so being exposed to infection. So it's during that period that they also cut their tooth. So what you notice is that because and also around this period is when they are at their lowest immune state, because the immunity that are given to them by their mom, it wanes down around that period. So there are a lot of factors taking place during the time that they are teething, that makes them to have fever, they are prone to malaria, they are prone to viral infection, they are prone to bacterial infection.
Mm.
So these are the things that are taking place during this period that they are teething. And teething itself too can be a little bit uncomfortable, but they don't necessarily have to run high fever.
Hmm. Okay. All right. Thank you so much for that answer. So let's move to febrile seizure. I've actually seen a few times where I remember it was a while ago where my neighbor's son was ill, and I think his temperature was really, really high. And the next thing, he had a seizure. Thankfully, people rallied around and all of that. But what happens when a child has a seizure uh, shortly because of a fever? How should parents respond if it happens?
Um, we describe febrile seizure as seizure that occur um, in the setting of a fever,
Mm-hmm.
especially in children under the age of from 3 months to 5 years. So during this period, they are prone to seizure that occur with the setting of fever, and some of these fever are caused by infection, like those what we have mentioned earlier: malaria, bacterial infection, viral infection. So immediately that they're having high fever,
Mm-hmm.
then there is triggered seizures, and they start uh, convulsing. So in that setting, what happens is, as soon as you notice this child is having seizure, please don't panic. Let this child find a comfortable area. Let
Okay.
this child probably on a flat surface, it may be on a bed, or somewhere on flat where this child won't, and remove objects that can injure this child. Most of the time, febrile seizure don't last more than just a few seconds or
Okay.
minutes.
Mm-hmm.
Doesn't last long, and it's usually resolved on its own. So just find a comfortable place to put this child, remove object that can injure the child. If possible, remove anything that can tighten the neck and allow this child to rest. Most of the time, the seizure will stop on its own.
Hmm.
Then you can take this child to the hospital so that they can find the cause of the fever, treat the fever, and the child will not, seizure will stop.
Okay. I want to ask a question still on this seizure. The question is, um, when it is, how to explain this? We've heard a lot of things like, oh, give the child, put a spoon in the child's mouth so the teeth doesn't close, wash the head of it, put water, go, 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 and how do you say it in Yoruba? Don't close his mouth, don't close his mouth, don't close his mouth, or things like that. Do those work? Do those work at all, or is it a case of maybe people are just being superstitious?
For a child that is having seizure, any kind of seizure, either febrile seizure or afebrile seizure, or those that are prone to seizure disorder, you know, forcefully opening the mouth with spoon,
Spoon.
pouring salt,
Yes.
or
Palm
pouring
oil.
whatever oil or
Yeah.
whichever
Yeah.
does not abet the seizure,
Hmm.
does not stop the seizure. Rather, we realize that it causes more injury to these children than the seizure that you are trying to stop. You know, a lot of time we've seen cases of where parents are trying to stop seizure, they forcefully open the teeth, the mouth with sharp object
Mhm.
or using spoon and cause injury to the uh, buccal mucosa.
Mhm.
And at the end of the seizure, you start nursing mouth sore for a long time. We've seen cases that parents will put the leg of this child that is convulsing, put the leg inside a hot fire, in order to abort the seizure. And at the end, causing bone injury for
Hmm.
these children. When seizure stop, then they will spend about extra 1 month at the hospital to nurse the bone injury that they cause, for the child while they are trying to nurse the seizure. Just as I mentioned earlier, the most important thing is not to panic. Find a, I mean, a flat environment to put this child. If possible, lay the child on his side, you know, and allow the seizure to continue. Most seizure will not last a few seconds and it will stop. For those that are having what do you call it now? Repeated seizure, epilepsy, seizures,
Yeah.
please, you can, at that point, take them to the hospital.
Hospital.
But most seizures don't last long to the extent that it's taking, so it will stop on its own. What you just do is that keep this child in a flat surface. Remove object that will harm the child, and within a few seconds, the seizure will stop.
Okay. But even on this seizure matter, what causes a fever? What causes the seizure? Is it because the fever is so high, or is it just something else?
Uh, it's not what we should realize is that when it comes to seizure, it is not fever may be one of the causes, especially in children,
Okay.
but it's not only fever that causes seizure. Seizure is when there is disruption in the electrical activity, of the brain. Brains send signals to the body, control the activity of the body, muscular activity, muscular movement of the body. But when there is disruption, in sending signals, to the body to do one thing or another, that's what causes, it causes disruption, then it causes seizure. Fever may be one of the causes, but it is not absolutely the only cause uh, of fever, but it's most one of the common cause of seizure in children.
Hmm.
And most of the time, you can't really explain the cause why, except fever cause seizure in children. The only thing is that it sort of resets the thermostat of the brain. You know, when high fever comes and it causes disruption of the electrical activity of the brain.
Okay. Hmm. All right. Okay. So what are the some of the common mistakes that you have seen that parents make when they are treating fever in their children?
Um, we some of the when it comes to treatment of fever,
Mhm.
you by the time a child is having fever, the first thing is remove excess at home. Management fever can be easily managed at home by removing excess clothes from the cloth from the child,
Mhm.
and also use lukewarm water, not cold, not extreme cold water. Don't pour extreme cold water on the child. Rather use
Mhm.
lukewarm water. And as we mentioned earlier too, some of the time, low grade fever of its own, it will take care of the body will take care of it, and it will stop. So when a child is having fever, pouring hot water or using uh, I mean cold water on the is not the best. Rather, we should use lukewarm water or just removing excessive clothing. Then expose the child to fan. Is enough to take care of the fever. And also there are some over-the-counter antipyretic, that can be given to this child when the fever is continuous and is higher up to 38
Nine.
degrees Celsius
Hmm.
or higher. For those children that are prone to seizure, because at high fever, some of them may not even reach up to this point before they start having seizure. You have to be careful for those kind of children, especially those that have history of febrile convulsion, when they have fever. So as soon as you notice this kind of children are having fever with their history, please give them uh, antipyretics, to bring down fever as soon as possible. You don't have to wait till they're having seizure before you start panicking and trying to control seizure.
Hmm. All right. One more question before we go, and this question is from what you're saying. Um, you don't have to take your child to the hospital immediately. You have to do your own part as the parent, like you mentioned, take off the clothes to reduce, the increase in temperature. Don't use cold water, use lukewarm water to give the child a bath. And then there's some over-the-counter drugs. But then how do parents know the appropriate dosage of the drugs to use to give their child in the case of a fever, because there's size also matters. That's the weight of the child matters, the age of the child matters. How do you know which one? I mean, when the child is a baby, you give the one that is like the drop one, then over time you move to normal. Like, how do you know which one to apply per time?
Okay, I will start by saying that for a child, for every parent that is nursing a child that is under 5 years, you have a thermometer at home.
Okay.
Mhm. Measuring fever or making diagnosis of fever by just putting hands on the body and
Hmm.
saying this child of have fever may not be the right thing.
Right.
The right thing is to measure with thermometer. That's what will be able to indicate and give you the correct measurement of the level of the fever that this child is having. So for a low grade fever, please, as soon as possible, remove clothing and
Mm.
cold comp. I mean, use lukewarm water, open fan. May be able to, take care of the fever. For no those high grades, you may go further and use antipyretics. Now, when you now come to your question, asking what's the dose?
Mhm.
Um, at home, as a mother, you may not really be able to get the correct dose
Mhm.
if your child have not used that particular medication, antipyretics before. But there is a guideline, especially, when you look at the manufacturer's
The
leaflet.
manual. Mm.
Yes, for the that will tell you for a child that is age of this and that,
Mhm.
use this. You can follow that, at least when you're at home. But the pediatrician have a better way. We calculate the dosage of medication that our patient need with their weight. But while you're at home, you can follow the manufacturer advice, with the leaflet that comes, with that medication. So that can be used for now. And we also, during our discussion, I also mentioned that there are some indications at which, you have to go and seek medical advice.
Mhm.
When you notice that this figure is lingering for more than 5 days in a child that is less than 2 months, no matter what, as soon as you notice fever, please, it is an emergency. Let the doctor see this child. For a
Mhm.
child that is less than 2 months, running fever up to 38 degrees Celsius, please
Mm.
go and see your doctor. For those that is having fever longer than three to child that is also having seizure, please take this child to go and see a doctor.
All right. Thank you so much, Dr. Kianla, for today's edition, free edition of Radio Doctor this morning. Thank you so much. Dr. Kianla has been consulting for us for free on the topic of fever in children. We've learned what fever is, the right temperature a child must be, and when to now start panicking or start being concerned when the temperature has gotten to 38 degrees and above. She's also talked to us about, the things to do as a parent, but ultimately, please go to the hospital. No matter how well versed you think you are in your being a parent, please, please, please go to the hospital. Thank you so much, Dr. Kenla, for today's edition of Radio Doctor.
Thank you for having me.
All right. You can catch Dr. Kenla as well next week on another edition of Radio Doctor on Mondays, where we talk about she consults for, on topics that affects basically children's health. Radio Doctor is broadcast 10 a.m. every Monday to Friday, every weekday. Many thanks to my producers, Rachel and Benjamin this morning, and to the executive producer, Tomoki Wadishanaya. Many thanks to you. Do have a healthy day. This is the Women Radio. You want to stick around with us because we still have great programming for you. With that being said, enjoy the rest of your day and your week. Bye for now, guys.